Hello, everybody. This is Councillor Bhangra. I'm here to discuss with our lead health chief, Councillor Stuart Carroll, in regards to the vaccine and dispel the myths. We have with us Mr Karnail Singh Pannu, who is the chair of the Windsor and Maidenhead Community Forum. Well, it's been going for 40 years now. So congratulations to Mr Pannu and his team for that. And obviously we've got our health chief here, who's a lead member for public health, adult social care, schools, children's services and mental health. It's Councillor Stuart Carroll for the Royal Borough. And we'll obviously ask some questions for the BAME, because we're obviously our community, who is the Sikh community who representing, but mainly the Asian BAME community also. We need to always dispel the myths that many of our community might have. So we will ask the questions to the lead member for the Royal Borough on this matter to obviously dispense people's fears. I think that's the important thing. But anyway, let's fire away. Mr Pannu, would you like to ask some questions to Stuart Carroll, Councillor Carroll? Thank you.
Yes, sir. Stuart, the first question was, how is the vaccination going on?
Yeah, well, thank you very much, Mr Pannu, and thank you, Gurpreet, for this invitation. I really appreciate it. And the local Sikh community is such an important community in our Royal Borough. And I'm absolutely delighted to have the chair here to answer some very important questions on vaccination. In terms of your first question, the rollout of the programme so far is going extremely well. It's going very, very rapidly. At very high pace, which is fantastic. We've managed to already vaccinate all care homes in the Royal Borough and the overwhelming majority of frontline staff within care homes. And now the Royal Borough is focusing on the next cohorts, which include people over the age of 70 and people in clinically vulnerable risk groups. And many of you would have seen these vaccination clinics ongoing in the town hall at Windsor Racecourse, and the NHS is leaving no stone unturned to ensure that that vaccination programme can go as rapidly as possible. It's functioning and working 24/7. As soon as doses are available, the NHS is then moving to contact people. And I just want to emphasise on that point that nobody needs to contact the NHS directly. The NHS will contact you. It's very important, actually, that none of us pester the NHS during this very difficult period, because the NHS is under a lot of strain pressure dealing with coronavirus on the front line, and also implementing the actual vaccination programme. So be assured the NHS will make contact with you. One thing I would just want to additionally emphasise, it is vitally important that every single person is registered with a GP. Because if you're not registered with a GP, the NHS will not know how to contact you. So please get that message over to everybody in your community to check you are registered with a GP and your contact details are correct. Now, in the vast majority of cases, that will be the case, but we absolutely want to ensure that we leave nobody out of this programme. So that's just one thing I would say on the back of your question, Mr Pannu.
Thank you, Stuart. The other question is about the first dose and second dose and gap between those two. Is it 3 weeks or is it longer than that, or does it affect at all if it's not done within that period?
That's an excellent question, and one I know people will be interested in. So there is an independent body called the Joint Committee on Vaccination and Immunisation, JCVI for short, and many people will have heard this body referred to in the media and the press. First thing to say is it's an independent body of government, so it has no political interference. It's made up of world-leading experts. In fact, I actually attend that committee through my current UK government role on the Vaccines Taskforce. Yeah. And decisions are made around what is the best schedule for giving the vaccine. And what that body has decided is that it's much better to give a significant number of people 1 dose rather than giving a smaller group of people 2 quick doses.
Yeah.
Because of course, if you were to stick to the 3-week regimen, you would only be able to vaccinate a smaller number of people versus a significant number of people, giving everybody the first dose. And importantly here, the data show from the Pfizer vaccine clinical trial and the AstraZeneca Oxford clinical trial that immunity from 1 dose does persist for quite a significant period of time until you need a second dose to boost your immune system. In the case of Pfizer, the evidence from the clinical trial shows that on day 14, most people will have a immune response of around about 89%, if not higher. The overall efficacy for that vaccine is just under 95%. So you can see that although there might be some gain from a quick second dose within 3 weeks, that gain is marginal versus actually ensuring that you get lots of people vaccinated with very high efficacy and protection with 1 dose. And it's similar for the AstraZeneca Oxford vaccine and also the Moderna vaccine, which has just been approved and will be coming to the UK soon enough. So what I would say, though, is the JCVI are clear that everybody should get their second dose. So 1 dose is not enough, but that second dose will be administered within 12 weeks maximum of you getting your first dose. Now, that could be quicker, depending on how quick the NHS can roll out the programme, but 12 weeks is the maximum, and that is based on the evidence which shows that that first dose will give you sufficient protection until you need that second dose to boost. If I may, I just want to emphasise one other very, very important thing. The NHS is making it very clear to everyone that even if you've been vaccinated, it's imperative that you continue to follow the guidance. So even if you've been vaccinated, it doesn't necessarily mean that you will be rendered immune immediately. And at this point, we don't know the evidence well enough to say whether someone vaccinated can still transmit or not transmit the virus. So even if an individual is protected, it may be the case, and this is where the science will tell us more when we get more evidence, that you could be transmitting the virus. So socially distancing, washing hands, staying at home, all of the current guidance is critical, even if you've been vaccinated.
Yes, yes, thank you. The second question is, I got a friend who both parents and 1 daughter are vulnerable. They got health issues. There's another daughter living with them, so they are on group 4, I think. So if they are vaccinated, those 3, then 1 is left out. Will that affect their vulnerability, or are they safe? Or will they be also done at the same time?
So what the NHS is doing, it will assess the patient list that it has and all clinical records and ensure that each person is appropriately categorised as to when they should get the vaccine against the JCVI national guidance.
Yes.
And in that instance, if someone is clinically vulnerable, they would be put in the appropriate cohort to get vaccinated at the appropriate time. I think what's really important, though, is that, just like we've talked about, that even if someone has been vaccinated, they follow the guidance. Of course, if you have someone in your household who is clinically vulnerable and they are shielding and having to effectively self-isolate, again, it's vital that they continue to do that, as difficult and as hard as that may be. I do appreciate that these lockdown restrictions are difficult, but this is about protecting people's health and people's lives, as we know. It is vital that's done, but also people living in that household also stringently follow the guidance, because that's the best way to ensure you don't get the virus and then you can't pass it on to anybody you're living with.
Thank you. Thank you. Now, I find we talk to people at the Gurdwara, they're most asking when will be my turn. Some are over 80s, they're not vaccinated yet. Some are over 70s, So they are waiting for, I said, I was 83, so I was vaccinated. Then it's coming down, so you wait. That's the way, or is it any other way they could prioritize?
So it is exactly as you say, Mr. Pannu. It's based on the hierarchy of guidance. So the way it has been structured is that people in care homes and frontline staff in care homes have been vaccinated first.
Yes.
Then it's moved to anybody over 80 and NHS frontline workers. It's now beginning to move into the over 70 group and those who are clinically vulnerable, people who have underlying health conditions.
Yes.
And so the NHS is working through at pace, and each person will be called at the appropriate time, the appropriate juncture to get vaccinated. If anybody has any concern at all that the NHS has missed them off the list or anything like that, they can always contact me, and I can give you my contact details, and we'll obviously put my contact details out when we distribute this video. But the NHS has been very scrupulous and very diligent at ensuring that the right people are being contacted at the right time. So I can give you that assurance.
Thank you. That's helpful. Now coming to school staff, it's next door, Boyn Hill. The children in classes for vulnerable children and the frontline workers' children. They are still there. In schools, there were 1 or 2 cases, like Desborough had an issue that my grandchild was sent home 3-4 times. Now they are off school, so we feel safe. And so is there anything happening at schools or school staff getting vaccinated?
Yeah, it's a fantastic question. And if I may, just before I answer that question, I just would like to say how fantastic it is that you have had your first dose of the vaccine, and what a great message that sends to the entire community about how the fact that the vaccine's safe, the vaccine works, and how important it is for all of us to take on our social responsibility to get vaccinated. So, you know, I'm really, really pleased for you as an individual, because you're a fantastic person, and it's wonderful to see you getting that vaccine and starting the process of being protected, but also the signal that sends to the community. So thank you very much for that. But in terms of schools, at the moment, of course, you're right, schools are only open for children who are vulnerable children or children of key workers. I have been actually liaising with all our schools and been joining some online lessons and speaking with our head teachers to understand how that is going. And within each school, there are very strict measures around washing hands. Each teacher has to wear a mask unless they're exempt, but if they're exempt, they would invariably be shielding, because it'd be too dangerous for them to be in the school environment. And there are very, very clear protocols in place to ensure that within those school environments, the schools are as safe as is possible. In terms of teachers being in line for the vaccine, you raise a really important point. I have actually been advocating to government that as part of what we call a second phase of the vaccination programme, so once we have completed the cohorts I described earlier, and the reason why those cohorts have been put first, we should emphasise, is because it's the cohorts that are most at risk of immediate death or very severe disease. So it's quite right, we seek to protect those people who need the vaccine the most. I think in the second phase, what we need to do is then prioritise key frontline workers, exactly as you described, the likes of teachers, teaching staff. I think we probably need to look at the police and other public servants who are by nature, by definition, on the front line and could be exposed. And I know the government is keeping that under very tight review and looking at the evidence base to see scientifically what would be the best strategy in terms of the next cohort of people to be vaccinated. But I will continue to advocate that teachers be top of that list, because if we do want children to go back to school and we want it to be safe, I think it's only fair and it's only right that we put teachers top of that list to allow them to feel safe and to reduce the risk to teaching staff when they're in the school environment.
Thank you. About the pharmacist group, so they are not like the town hall, you got to get through the National Health. So the pharmacists, they run their own list, or it is still controlled by the National Health?
So it's still controlled by the NHS. This is a centralised system, and the reason for that is to ensure that nobody gets missed, but it's done in a very smooth, efficient, controlled way, which is absolutely critical when we're dealing with millions and millions of doses of vaccines, but also to ensure that millions and millions of people get the vaccine when they need to get the vaccine and as quickly as possible. So pharmacies have now joined the cohort of service providers, not all pharmacies, but a significant number. And they are also now helping the NHS move even more rapidly, even more quickly, to ensure that that vaccine and the vaccination program can be delivered. And that's fantastic news, you know, because the quicker we can get the vaccine out to people, the quicker we can get people protected, the better.
Thank you. I got one more question. That is, by talking about children, what age group we are saying that it's above 18 or above 16?
So at the moment, the JCVI have only qualified guidance up to the age of 50 and above in terms of the cohorts that are identified. And of course, anybody who would be classified as a key frontline worker, whether that be in adult social care or the National Health Service. So of course, you have people under the age of 50 working in those public services who are in receipt of the vaccine and will be getting the vaccine. In terms of the next level down, that is something that will be considered by the JCVI, but that, of course, is a function of the evidence base and the science. To what extent do people with healthy and younger immune systems need the vaccination? And also based on supply, because one of the things that we always have to keep in mind here is how many doses do we have that are available. The good news there is that the UK has been very, very quick out the traps. We're leading the way in terms of the vaccination programme and the number of people being vaccinated. We're significantly ahead of virtually every other country. But what I would say to that is, you know, although it's great to see the UK moving so rapidly with the vaccination programme, ultimately this needs a global solution because pandemics are by definition global. So I think the UK will also need to play its role as a credible, reliable international partner to help other countries get access to the vaccine, but also expertise around how you deliver a vaccination programme. Because if we want to have our world opened up again to international travel and international trade and international business, the whole world needs to be vaccinated against coronavirus to stop it spreading and stop it transmitting. So it's all of these different elements that form decisions about who should be vaccinated and when, but it is really good to see the UK taking a lead here and being very, very quick out the traps. And my ultimate message, and I'm very, very pleased that we've been able to have this discussion, Mr Pannu, is, you know, please do get vaccinated. When the NHS makes contact, please respond, book an appointment. The vaccine is safe, it is effective, it's been independently verified. And if anybody has any concerns or any questions, you can always contact myself. There's nothing wrong with having questions or concerns, that's perfectly normal. But please do get your information from official independent sources, because sadly there is a lot of misinformation out there, and we want to ensure everybody is protected and everybody can stay healthy.
Thank you. It's absolutely wonderful. One question people ask is this variant Does it any this vaccine got effect on it, or it'll be different vaccine?
Yeah, so all of your questions are brilliant questions, I have to say. I think you're nearly as expert as me in this, I have to say. So you've been doing your reading, doing your homework. But in terms of the variant, from what we can see at the moment, there are different types of variant, and that's not unusual. You know, viruses do mutate, they do change. So this isn't something that's specific to coronavirus. It happens with other infectious diseases. The early evidence would suggest that the vaccines will be effective against these other variants, but I must stress that's only provisional evidence, and we need to continue to look at the science, continue to look at the data to get a better handle on that. What I would say is, as an infectious disease expert, that there is a reasonable hypothesis to say that even these new variants will struggle against the vaccination, because the vaccination, in the case of the 3 that have been approved, are effectively equipping the immune system with the critical protein that can then help break down coronavirus, its spike protein, which can then effectively shed the virus and ensure the virus doesn't remain in the body and is disposed of. And because of that, the hypothesis at this point would be that even with a different type of variant, the same mode of action as to how the vaccine would seek to tackle and defeat coronavirus would hold. But we do need to continue to look at the science, the data, but there is a reasonable hypothesis at this point to say the vaccine should be effective, or at least should have some effect. And of course, because of that, that's another reason why it's critical people get the vaccine, because we do know some of these new variants are a lot more transmissible and therefore can spread this virus a lot more quickly. And so by getting vaccinated, you're not only protecting yourself, you're protecting others, you're protecting your loved ones, your friends, your colleagues, your family, and your community. And that is one of the strongest reasons of all, I think, to want to get vaccinated.
Thank you, sir. You answered all my questions beautifully. Well done.
Thank you,
I
Mr.
will do anything I can do. I will publicize it. I will speak to people, assure them, go and get vaccinated when your turn comes.
Thank you very much. And, you know, can I just say, before I pass back to Gurpreet, the fantastic job you are doing and have done for many, many years as a community champion, and not just within the Sikh community, but across all of the community. And I think you are, you know, a tremendous role model to all of us, and it's always a pleasure and a privilege to speak with you and on this particular critical issue of public health and vaccination. I can only thank you again for your leadership. It's absolutely tremendous.
Thank you, sir. God bless you. Stay safe and stay stronger. Love you.
Thank you very much indeed, and you too.
Thank you. And I would like to thank Mr. Pannu, who is the Windsor and Maidenhead Community Forum Chair, and congratulate him on the 40 years that the Community Forum has been going. And he is the president of the Maidenhead Sikh Gurdwara that is in the ward of Boyn Hill. So we're very lucky to have that in our ward. And we'd like to thank the lead member for our time today, Councillor Stuart Carroll, who's a Royal Borough lead member for Public Health, Children's Services, Adult Social Care, Mental Health and Schools. So thank you much for your time today. And this is very important that we all play our roles to dispel the myths of scaremongering of the COVID vaccine. It's very, very important. So I'd like to thank both of you for your time today. Thank you.
Thank you very much.
Thank you.